And welcome back to The Factor Uncensored. An outbreak of measles in Texas and New Mexico now nearing 100 cases. Health officials say more than 95% of these cases are in people who have not been vaccinated. The measles vaccine has been around since the 60s. Typically, kids are fully vaccinated before they start school. Now, the CDC says 95% of a community needs to be vaccinated for herd immunity. Some of these Texas counties at the heart of the outbreak have vaccination rates closer to 80%. My next guest, Dr. Danish Ali of Archpoint Pain Institute, has more information for us tonight.
We've seen an outbreak in measles in the last few weeks, specifically in Texas. We haven't seen such a high amount here in Harris County per se, but this virus is very contagious. And also folks who are elderly or have other medical conditions, it can cause them to have a lot of complications like pneumonia or infection in the lungs, or even in their brain, they can get what we call encephalitis or swelling in the brain. And so, yes, we're seeing some of these complications from the hospitals and from these patients having this measles. Let me remind and back up a little bit, Isaiah. This is generally a vaccine that is given to children that are born, and at 12 to 15 months of age, they receive this vaccine. They get a second version of this at the age of 4 to 6 years of age, and that is supposed to hold you down for 99% of the time, meaning it's 97 to 99% effective. And what we've seen is that there's been this outbreak because measles is very contagious. One person that may be infected, Isaiah, can infect over 40 people. And versus COVID, when we were in that outbreak, one person was potentially infecting up to 3 people. So the contagioncy is very strong, and it's spread through airborne and also droplet. So anybody that sneezes, coughs, or breathes, that virus can linger around for over 2 hours, and that person may not even know, and they may take that, or they may get that virus, and now they have caught measles as well.
And Dr. Ali, let's double back a bit. Why are we now seeing an increase in measles cases when so many people have had the vaccine when they were children? Why are we seeing, I think, at least 100 or more than 100 now?
Yeah, Isaiah, there's 2 reasons for that. Number one is the highly contagiousness that we discussed, right? This virus itself is very contagious. So even 1 or 2 people getting it, that results in an outbreak, and a lot more folks get it. Number one. Number 2, the other thing is there is a time frame. If you were born after 1957, but you received the vaccine before 1968, that vaccine dosage area that was given, it's noted that it was not as effective at that time. And so those are the folks that may also get reinfected or infected for the first time. And so if you were born after 1957 and you received the vaccine before 1968, that age population, they're at a higher risk to develop measles. And again, it's very contagious, and it can last on surfaces throughout different areas for hours at a time. And so that's why we're seeing this high number of cases here.
Now, would you suggest those older people go and get a booster shot?
That's correct, Isaiah. For those specifically in that time frame that we've discussed, I do believe that it behooves you to consider getting a vaccine or getting a booster. However, generally speaking, given how effective these vaccines are, it's not just recommended for everybody at this time. So if you got it within that time frame, you may want to consider, talk to your doctor about this. But generally, everybody else, if you have somebody that you may have been in contact with, or you know that somebody has one, those are the folks that you want to be very careful about, because it spreads very fast and very easily.
Now, for those who are wondering, they blow it off, oh, it's just the measles. Can it be, how serious can it be if you get the measles and you're not able to sustain with it?
Yeah, Isaiah. So this measles is a virus and it can spread into your other organs, specifically your lungs, and it can cause pneumonia or an infection in your lungs. It can spread in your stomach and GI tract and give you a lot of GI issues, such as diarrhea, nausea, vomiting, and it can spread to your brain where it can cause swelling and infection in your brain, encephalitis or encephalopathy. And so you want to be very cautious, especially if you've been around somebody or maybe you have a child that has been on it or developed it. You want to make sure that you take all the precautions. And those specifically are making sure that you're cleaning your hands, either putting a gown on and gloves if you're having any sort of contact. The folks that develop measles, Isaiah, they can, generally speaking, their symptoms are more like flu-like symptoms for the first few days before an actual rash develops. And so what we see is that those few days, they may just have those flu-like symptoms, but they may be around other people, but it spreads at that time as well because you have the virus and it's spreading rapidly.